There is a widespread belief that people with diabetes should avoid eating fruits. Many think that consuming fruits can spike blood sugar levels and worsen diabetes. However, this is a misconception. Not all fruits are harmful to diabetics. In fact, some fruits can be highly beneficial when consumed in the right quantity and at the right time. Renowned doctors and health experts emphasize that diabetics should include fruits in their diet rather than eliminating them completely. The key is to choose fruits wisely based on their effect on blood sugar levels. Whenever we consume food, two key factors determine how it impacts our blood sugar. 1. Glycemic Index, GI. This indicates how quickly a particular food increases blood sugar levels after consumption. And 2. Glycemic Load, GL. This measures both the quantity of glucose present in a food and the speed at which it is released into the bloodstream. Foods with a high glycemic index release glucose into the bloodstream very quickly. As a result, blood sugar levels rise sharply within a short period. For example, if you eat a biscuit and check your blood sugar 30 minutes later, you will notice a significant increase. This is because biscuits have a high glycemic index, meaning they digest quickly, and the sugar is immediately absorbed into the blood. On the other hand, foods with a low glycemic index digest slowly and release glucose gradually, preventing sudden spikes in blood sugar. For instance, if you eat a cucumber and check your sugar levels 30 minutes later, the increase will be minimal. This is because cucumbers take longer to digest and do not rapidly release glucose. While the glycemic index tells us how quickly a food raises blood sugar, the glycemic load considers both how fast and how much sugar a food releases into the bloodstream. For example, some foods may have a high glycemic index, but a low glycemic load because they contain only a small amount of sugar. Other foods may have a low glycemic index but a high glycemic load because they contain a large amount of sugar that is released slowly over time. Take bread, for example. Eating bread won't cause an immediate sugar spike, but as it digests slowly, it steadily increases blood sugar levels over time. This means that even if a food doesn't seem to affect blood sugar right away, it can still contribute to long-term blood sugar elevation. The good news is that most fruits have a low glycemic index and a low glycemic load, making them suitable for diabetics when consumed in moderation. So, here are some general rules to keep in mind. Fruits with a glycemic index below 55 are considered safe for diabetics. Also, fruits with a glycemic load of 10 or lower are ideal for diabetic consumption. However, portion control is crucial. Even healthy fruits should not be eaten in excess. Here are 5 highly recommended fruits for diabetics. First up, we have grapefruit, also known as Citrus paradisi. It has a low glycemic index and a low glycemic load. So why is it good for diabetics? Well, grapefruit does not cause a sharp rise in blood sugar levels. Plus, it is rich in vitamin C, which strengthens the immune system and acts as an antioxidant, reducing oxidative stress in the body. Speaking of benefits, vitamin C helps in collagen production, keeping the skin youthful and healthy. And for heart health, the fiber in grapefruit helps lower cholesterol, reducing the risk of heart disease, a common complication in diabetics. Next on the list we have cherries. They have a glycemic index of around 22, which is very low, and a low glycemic load. Now, let's talk about the health benefits. Cherries are packed with antioxidants that help the body fight inflammation and improve insulin sensitivity. They also contain compounds that help regulate blood sugar levels naturally. For a recommended portion, a handful, about 40 cherries per serving, is safe for diabetics. Next up we have the avocado. With a glycemic index that's very low and a glycemic load that's also very low, avocados are truly a superfood for diabetics. You see, avocados are low in sugar and high in fiber, which helps slow down digestion and prevent blood sugar spikes. They also contain healthy fats that improve cholesterol levels and promote heart health. Although avocados are not very common in Pakistan, they are a fantastic choice for anyone managing diabetes. Apples. Their glycemic index is 38 and their glycemic load is about 5, which is very low. Apples contain fiber, vitamins, and minerals that are essential for overall health. Eating an apple in moderation does not significantly increase blood sugar levels. Remember, portion control is key. Eating 1 apple a day is beneficial, but excessive consumption should be avoided. Plums. Their glycemic index is around 39 and their glycemic load is 5. Plums contain powerful antioxidants that help regulate blood sugar levels. They are rich in fiber, which aids digestion and supports gut health. As with other fruits, portion control is important. A moderate amount is ideal. Bonus. Tomatoes. A controversial but beneficial fruit. Many people do not consider tomatoes as fruit, but for diabetics, they should be treated as one. The glycemic index of tomatoes is very low, and their glycemic load is low as well. Tomatoes are packed with vitamins, minerals, and antioxidants that improve overall health. They help reduce inflammation and regulate blood sugar levels. However, tomatoes contain oxalates, which may contribute to kidney stones in some people. Therefore, they should be consumed in moderation. Always check your blood sugar levels after eating any new food to understand its effect on your body. If your sugar levels increase significantly, reduce the portion size of that fruit or food. If your sugar levels remain stable, you can continue consuming it in moderation. Exercise regularly and maintain a balanced diet. Follow your doctor's advice and take medications as prescribed. With proper management, diabetes can be controlled effectively, and in some cases it may even be reversed.